and brought up in India. Did my bachelor's in biomedical engineering. Then I moved to Germany, and that's where I did my master's and PhD in BME. And this is the time when I met with Dr. Arup Sarkar, and we played a lot of cricket together in Germany. So it was a lot of fun. Then I moved to US, and that's where I had an opportunity to do my postdoctoral research at two different institutions, starting with the University of Pittsburgh, and then I did at Carnegie Mellon University. And then I moved to University of Rhode Island in 2014. Since then, I am here, working on different kind of research projects. So when I arrived at University of Rhode Island, I conceived and created a wearable biosensing lab. This particular lab has evolved a lot in last few years. So in fact, now we even have a vision for the lab, and the vision is to serve the global citizens with health technologies, and then also we have a mission, and mission is to build a team of diverse talents and future leaders, and who are very interested in designing human-centered smart wearables and health technologies. And particularly, we are interested in designing these things, but we also need to make sure that we are actually working with the community of different kind of stakeholders, including patients, caregivers, physicians, therapists, healthcare providers or workers. We need to know problem at a grassroots level. And we can do a lot of development in the lab, but if it is not useful on the other side, that's not then our mission. We really want our mission towards taking outside of the lab and meeting with the applications in the healthcare side. So with that reason, we have actually a research area which we have dived into. One is the wearable systems and brain monitoring. Wearable system has been our major focus, and also along with the wearable, we also design technologies for brain monitoring, which tend to be wearable brain monitors. We of course in today's world, we are surrounded by all this kind of wearable devices around us. So we also do research on smart watches. We also do research on digital health, where we design mobile health platforms. We design brain technologies, tend to be non-invasive, and wearables more towards that side. We work a lot in smart textiles, and this has been our major focus in recent years, smart textiles. We have recent interest in how to design engineered smart textiles for infants, particularly premature babies. And we work a lot in 3D printing, and also how you can use 3D printing in prosthetics. So for today's lecture, I would like to focus majorly on two items. Because there are a lot of projects, and I don't think I'll be able to cover everything, but I was thinking that why don't we have a focus? So smart textiles and 3D printed prosthetics, these are the two projects I have chosen because I think it has a lot of relevance with the global problems what we are facing. Again, this is a little interactive lecture, so in case if you have a question, either you can actually pass that question to a team of organizers like Akhil and Anushka or Dr. Sarkar, who can gather the questions, or you can unmute yourself and you can ask me a question. I don't mind being interrupted in my lecture. So let's go with the smart textile first. The Parkinson's disease is one interesting movement disorder that I came to know from a Dr. Samay Jain, a neurologist, University of Pittsburgh Medical Center. When I was doing actually postdoc at Carnegie Mellon, I came to know this neurologist, and he came to me with a question, and he said that, do you know anything about Parkinson's disease? And we think that the wearable technology can help with the Parkinson's disease. And this was the time in 2012, by the way, 8 years ago. Um, and he started to explain to me, what the Parkinson's disease is. So essentially, the Parkinson's disease is a movement disorder. It's a progressive neurological disorder which affects your movement greatly, and it doesn't. It kind of motor, fine motor skills, something like which you use it on daily basis for even eating food, to writing something, or even walking. And gradually it progresses so much that you would become disabled. And it's not movement disorder. Even though it is movement disorder, you have a lot of other areas of your functioning affected, including your speech as well as your mental health, your sleep. All these things are heavily affected. So this is a very, very diverse disorder, which kind of, you can't say that one person you meet with Parkinson's disease, that means you know everything about Parkinson's. Every person is different, and it's unique symptoms that they face. And if you look at the health-centered healthcare today, this is something which is out there in majorly every country. And if you what happens, it not just Parkinson's disease, but also other disorders as well. That what happens when you have a chronic disorder, what you do is that you have a periodic visit to your doctor, and you are getting checked on your symptoms essentially, and based on that, doctor gives you prescribed medication. So what it happens that the physicians kind of check you every once in a while. So if you look at it over here, and then you go back home, and of course physicians would kind of consider that the medication is working without any problem. And of course, you are doing your daily life activity, and magically all these symptoms will be going away. But that is not happening in majority of the chronic disorders, including Parkinson's disease. That medications are not going to be effective right away over there. Sometimes it takes time, and sometimes you never be able to find a correct medication doses and its rate that it can be more effective. So I do not know a lot about Parkinson's disease in India, how much it is affecting, but in US and Europe, it's a major problem. We have seen something like around 10 million people, around the globe right now who are suffering with the Parkinson's disease. So what we came up with at that time, it's in early 2013, that when the only one smartwatch was available in the, and that was called Pebble Watch. And the doctor said that, what do you think, if can we use smartwatch to monitor movement symptoms of Parkinson's? And I said, that's an interesting idea. We do need to kind of try it out and see whether it works. So we came up with this idea of like bringing the smartwatch in their clinic, and then you have patients with Parkinson's disease wear it. Then we ask them to do certain movement activities, and those movement activities were pulled out from in a protocol that is used by neurologists in their clinic on daily basis. So, and one of the things I'm showing over here is the hand flipping exercise that they need to do. So it is almost like you are flipping your hand, and it's a 180-degree flip. And they ask you to do like 10 times. And like that, there are many other exercises, something like, tapping your finger, those kind of exercises. So idea was that whether this smartwatch is able to detect those activity more accurately. Again, we are talking about clinical accuracy, not like in general sense, just sensor accuracy. Clinical accuracy, what it means is that doctors should be able to make diagnostic decision, right? Whether somebody has Parkinson's disease or not, that kind of, plus the medication is working or not. So those kind of things that they need to look at. So, we did I'm just talking about one large experiment we did in a one single slide. But this is what we found out at the end with the machine learning approach. And we had some success and some failure. But when at the data, doctors were saying that again, we do need to do more experiments on this, and but initial was promising. But I was not satisfied. I don't think that the watch, which is just sitting on your wrist and would be able to actually monitor your fine motor movement happening on the finger, and that's very difficult for even smartwatch to detect, because the sensor is not at the right location. So what I thought at that time, then I came to University of Rhode Island at URI, and I started to think that can there be something else that we can do with this problem? That the one solution may not work efficiently like smartwatch. So we thought that why don't we have technology that can be developed for smart something like a smart glove. And then I had an opportunity to talk about this idea with some of the top-notch doctors around in the region, Dr. Friedman, Dr. Akbar, and I went to them. I went with this idea, and they said that it's an interesting idea. We should really investigate about this one, and I had a background in a smart textile as well during my PhD. So I did work on a smart textile based ECG monitoring, those kind of technology. So I thought that I have some experience and I can actually dive deeper into this area. And so, I created this, an idea, we called it an Kaya, an Internet of Smart Textiles for Telemedicine. What it means at the end is that not just in a clinic data collection, but is it possible to have this data collection happening at home? So the idea is that you would have actually smart gloves and smart socks, at least at this moment, but then we have changed that idea a bit. But smart gloves remains the same, and we wanted the sensors and everything. These are concept diagrams, by the way. These are not the real gloves with the sensors in that, but these are concept diagrams that we would have sensors and computing circuits and everything there. And then patient would be actually sitting at home. They would be doing some kind of basic testing. Again, we are not interested in a 24/7 data collection over here. We are interested in collecting data for only 5 to 10 minutes, because we are only doing an evaluation of their symptoms. There is no need of 24/7 data collection, and there is no meaning of collecting such kind of data, because doctors have no interest in looking at 24/7 data, unless somebody who is an AI person who will push you to say that, no, we need to have 24/7 data because AI models need those kind of data. But this is not the case when it comes to the clinical interventions, that they don't need that kind of data. Eventually I applied for this technology, because any project will require finances. And I went to National Science Foundation, and I received a career award, which is a nationally recognized award by NSF in US. And that gave a lot of confidence to me and my team that this idea has a wing, and we could take it to a next level if we have a funding and a right project. Planning. So what we did right after we got this grant, and then we started to build our e-textile technology. So you can see that there is a glove with the sensor embedded into it. Then we also created an insole. So we converted from socks to insole. There were a number of reasons, because many people say that it is difficult for them to wear a socks many times. So that's why they do not want to wear a sock. So we say that, how about if insole, because you just wear the shoes in general. So insole was an acceptable, wearable for them. And then there was an edge, which is more, I think, many of you might know that it is like how you can have it in computing happening in a remote setting. So, and then how this technology, how this data can be processed and given to a doctor. This is Dr. Akbar, by the way, in Rhode Island Hospital. And if they can look at this data remotely, and again, their data is different than the data what we talk about in a computer science or in a computer engineering model, electrical engineering, signal processing algorithms. These are different data, by the way. They are only interested in looking at just numbers at the end. That can you tell me what number it is for this exercise or this exam? So we have to we know that we had to work a lot in this particular framework, not just designing the technology, but also how to process and convert that in and translating that technology in the format that doctors would be able to make decisions on that. So let's start with the technology development side of this. So the smart textile, it's a very growing area. It's not like something that you have out there and you can go to somebody and they can make you. If you want to have even a contracting with company on textile or smart textile side, company will have a hard time to give you a contract because there are no machineries out there that can allow you to do in a smart textile manufacturing, or even a prototyping is difficult. And that's why the things are growing a bit in this area. So what we did is that we started doing a lot of prototyping in our lab, and it comes with the sensor that can be integrated in the basic fabric material. Or you can create your own sensors that are actually a part of the textile itself. We have taken an easier route in the beginning, that we will be embedding on existing objects, and then also we will be creating in hardware. So we started to create a hardware to be able to collect the data from the sensors. So let me tell you a little bit of process of how the smart textile design would work. So this was our first textile design, initially when we started, and you can see that any engineer would do something like this in the beginning. That you buy those sensors from the shop, off the shelf sensors, then you stitch it by yourself, and then you have Arduino sitting over there and look at the data, and then you feel happy on the end of the day that this is great, our technology works. And if I analyze today, I feel that was so pathetic design what we have created, because I don't think that this kind of technology would work on a patient end. It would work only in your lab to make yourself happy for a while. But of course, it helps you to collect the data in the beginning. So then what we did is that we started to recognize that we don't have expertise of textile design. You expertise of technology side maybe, but not the design side of that. And that's where the collaboration started to happen. So we started to bring in textile designers on our team. And then if you can see that, they were actually planning very well. This is like without planning Arduino-based technology, and here is the with planning that they actually said that you don't want to have a glove and then on top of that you want to create sensors. They said we'll create a glove, and then we will see the sensors are embedded within that. So a lot of planning went in, that how we're going to kind of place the sensors, and placement of the sensors are very important in that case, because it needs to look at your, I don't know if you're able to see my hand, but we should be able to look at our knuckle movements, essentially, and how these knuckle movements are moving. And all those kind of things is depend on the how you have placed the sensor on your hand, on your fingers particularly. So and then there is another thing happened, is that one second. So if you look at this particular technology over here, this one was created by the textile designers. But there was one more problem in that we took this kind of gloves to the patients, and patients were saying that, will I get a shock of using the sensor, because I can see sensors everywhere, and this is electrical components, and so we kind of took that as an iterative process. We thought that we need to conceal all these things. It needs to be completely invisible. So we created a glove that is something like in a newer design, and in that you wear a glove, but all the technology is concealed. It is not visible. You have a layered glove. So one of the layer, that's where you have a sensors embedded into that, and then you have also your module which is hidden, and you just open up the glove, and then you would be able to see that. And it had a better acceptance in the patients, even though the glove is a little bit clumsy, I would say, and we are currently working on making it more sleek. But it's a technology that they had no problem wearing it, and they were feeling completely comfortable to do those exercises with that. And it goes with the the architecture. So I am giving you just what kind of sense technology out there inside. So we have 5 finger sensors, but also we have an IMU sensor, which means accelerometer, gyroscope, and magnetometer over there. So essentially, we have something like around a 14 channel system. Just the one glove is a 14 channel system, which goes with A to D converter. And then we have we are currently actually having the version 2 created in the lab, and we are investigating to improve some of the data acquisition and communication protocol over there. And everything is runs on the battery. So here, I don't know how will I do it, but let me see if I can actually if I have a chat open here somewhere. Okay, I would like to do this a little bit interactive. And this slide will be interesting for everyone because this is the one and will be. So I will play 3 videos, and I would like audience, and I'm going to have an audience poll or audience survey over here regarding these videos. And I would like to use a chat function, chat window, to just tell me your opinions, about a particular thing. So I'm going to play 3 videos. So I play first video over here. So you can observe very carefully how hands are moving. Video number 2. And if you can observe how the finger tapping task this person is doing. And number 3. Okay, here I have a question. And the question is that if you can write in the chat which one was the healthy participants, 1, 2, or 3. Which one is a healthy participant? Just looking at the video, which one was a healthy participant? Okay, we have majority. We have number 3 over here. We have 1 is 1. Some of them you are saying 1. Let's say which one is most severe patient who has a severe symptoms of Parkinson's disease. Okay, number 2. Okay, somebody says number 1, 2. Okay, 2. Okay, so here it goes. I think the people who were right. You should definitely consider being a neurologist and go and maybe get into medical school, because you guys were accurate in observing how the movements are. And this is what neurologists they do, that they how the hand has a consistent movement. If if somebody asks you to do a finger tapping task 10 times with the opening the biggest, and then also do it as quickly as possible, you can see that number 3 was doing really right. And if I play it again, and you can see that how their signals of both fingers are time series signals looking like, and it's almost like a sinusoidal. If you can see the signals over here, very similar in the thumb. And again, by the way, the placement is still sometimes problematic because of the different size of the hand. Right? We are using the same glove, but it's going on to the different size of the hand. Somebody has a longer finger, somebody has smaller, somebody has a bigger palm. All this kind of thing we have to consider very well in our design. So right now it's a first kind of, version that was working fine. And now we are working on making like, almost like in a clothing style that you have in a S, XL, double XL, something like that. So we are creating the style on that. If you look at the other one, number 2, it was a very severe. That's correct. And if you can see that the signals are not very much periodic. It's a quasi-periodic over there. And the number 1 was actually, I would say, moderate Parkinson's disease. It was Parkinson's disease. It is not a healthy participant, but it was a moderate or mild Parkinson's disease. But one interesting thing, if you note over here, is that number of times that person has done the finger tapping in a 10-second is very high compared to other people. Do you see how often that person has done the tapping? You can see over here, the tapping is really fast over there. So the speed was really fast there. So this is one of the features. So let's talk about the, bit about the features that are important to look at. So smart gloves, I'm going from design to now more onto this, what the sensor data looks like and what observation you can make out of that. So if you look at the healthy participants data, which was almost very clear, and you can do a peak detection, and you can actually see that how you can look at the number of taps happened and how fast the number of taps happened in a particular given amount of time. And then if you look at the mild, which had a very high tap, and again, doctors have their own protocol of scoring them. It's not always that you have a high number of taps that means you are a mild Parkinson's, but they have certain observations that they make. So we have learned that. And then you have a severe. So if you are looking at the amplitude, so amplitude, that means how far I have gone with my hand up and down. So how far I have gone. And that one, if you see that almost it is consistent in a healthy participant. Of course, we need to neglect number 1, like the initial and last, because at that time you are actually starting the activity and you are stopping the activity. But in between, the most important time to look at the data is right in the middle. And you can see almost it is flat. The other one, if you look at the mild, had an amplitude change which was larger. The amplitude variation was very large. And number 3, the severe had a very large variations. Then if you look at the tapping frequency, what it means that how fast I did it and what was the difference between my tapping speed. So you can see that almost healthy had a good one, but also actually the mild also had a good one. The reason is that if you're doing extremely fast, your margin of variability is not that high because you're already doing fast. How much margin of variability would be there? And number 3 had a very big difference. The variability was very high. And this was like we are doing some more testing over there, like what is the rise time, fall time, those kind of more detailed feature extractions. So we have worked on that, and we are still working on that area, and we are applying machine learning there to distinguish all these kind of categories there. The other thing is that because we are thinking about this technology to be given to patients, and they should be doing it independently in the future. So idea is that they are going to use it by themselves, or they will have caregivers who will be giving them and helping them to collect this data. So what we did is that we have a number of exercises that they need to do it. So what we have created a mobile health app, and whether they can use their smartphone or they can use a tablet screen to collect the data by themselves. And it actually screen has been created. So here I'm going to play the video to show that how they can actually do the data collection by themselves at home. So this is, and again, this app, what I'm showing you over here is not completely designed for in-home data collection. It was designed for the doctor to do scoring at clinic, but this almost the framework of the app is not a big difference. We are just going to eliminate the scoring part over there. Besides that, it's going to go one after other, that they just keep clicking next, and by the time they would be doing the exercise. And our system automatically knows that they have completed the exercise, though it automatically goes to the next exercise. So that means in the real time, the processing is happening in the mobile app platform. And also we have a communication protocol on an Internet of Things side, which is pretty complicated. I can't go in detail, but this is more or less the protocol stack framework that we have. We are using MQTT and Bluetooth to, and also we are currently considering Wi-Fi as our communication protocol rather than Bluetooth, because we have actually higher throughput. Consider that these are not only gloves, but we also have 2 insoles. So that means we have 4 independent systems connected to mobile phone or a tablet, where you have 4 systems. Each system has 14 channel data. So essentially you have 14 multiplied by 4. That many channels of data needs to be processed or needs to be communicated to a tablet and then stored over there, and then needs to be processed. So the other thing is that on the signal processing and data analytics side, I just talked about the finger tapping task. I only gave you a case study of a finger tapping task. I have even not touched upon the all other exercises that we need to process and create a features from there. So we have worked on each and every task, and then we have actually defined the features that would be appropriate for scoring them. And currently, we are actually finalizing our algorithms on the machine learning side, that how this will be distinguishing. The problem, what happened is that because of the COVID, our data collection study is on hold. So we are waiting for market to open up, and we can invite patients to come to our lab, and we can collect more data. So then we can take it to a stage number 2, where we can collect the data at home. So that is where we are currently, with our progress of this project. And Kaya team is made up of, in core, we have 3 people. I have a PhD student, Nick Constant, and me and Dr. Akbar. So we are like a core team. We are working. And by the way, the Kaya, as you know, that Kaya is a Sanskrit word, and that means body. By the way, but this name Kaya didn't come from the like Sanskrit initially. Of course, we kind of found out that was so coincident. Nick Constance, his dog's name was Kaya, by the way, and he said, "I want to give the name Kaya," and I asked him why, and he said, "My dog's name is Kaya." So, and then I told him that Kaya also means body in our Indian roots. So that was an interesting coincidence. And it's a core team, but we are not small. We have so far almost close to 20 people worked on this project. Not at a time, people come and go, because as you know, that academia is a dynamic environment, that you have students who are graduating, and then new students are coming in. But if you look at it, the diversity of the people we have on this team, from electrical engineering to the textile engineering, we have this few people came from IIT Delhi, Adi and Sahil. They came from IIT Delhi from textile engineering. Then we have people coming from computer engineering and electrical engineering. We have computer science people. We have biomedical engineering people. And textile design people that I should importantly mention them. And they are the one who kind of converted this our crappy hand gloves into a well-designed gloves. Let's hear from a patient themselves what they talk about this technology.
My name is Andrea Huffman, 71 years old. 15 years ago, I was diagnosed with Parkinson's disease.
Andrea uses an app on a tablet which connects to the smart glove wirelessly. After the connection is successfully established, The
My name is Andrea Hopkins. I'm 71 years old.
Smart Glove wirelessly. After the connection is successfully established, the app guides her to perform specific movement tasks. The Smart Glove has several high-resolution stretch sensors which can pick up fine-grained symptoms present in the hand and fingers. The glove data is sent to the tablet for storage and analysis.
Yeah, and also if you can see that here is insole data, and sometimes I have to become patient to collect the data by myself too. So these are showing the the how time series data looks like from the textile sensors. Now we have completed smart textiles. I would like to take a pretty quick pause and I want to ask if there is any question regarding smart textiles so far. And then we can move to the next one, which is going to be pretty quick. It won't take longer in the next project. So if you have any question, feel free to ask right now and also at the end of the lecture. Okay. So let's go to the 3D printed prosthetics. This will be pretty
Sir,
interesting. Yeah.
sir, these gloves which you talked about, can they stand the external factors like if by mistake some water is fell upon them or they get wet, then will they work the same?
Oh, no, that's a very interesting question and very important question. So far, the gloves are made of cotton material, so it's not a waterproof, unfortunately. And we do not recommend these gloves to be used, in a highly humid environment. And these are some interesting questions that we have to answer in our next design research, I would say, and how we want to know different kind of isolation layers we could create, but without increasing the physical resistance to your movement. So if I'm doing this movement, right, and if glove is creating a resistance for my movement, then we are actually affecting the data collection. But at the same time, the things what you mentioned is really interesting, and we do need to work on this. I see one question here that what was the communication protocol used? We have used MQTT protocol, pretty standard nowadays for the data communication between the wearables and the fog computers or edge devices. Currently, they are powered through the battery. We have a lithium-ion battery that are rechargeable, and we have actually a rechargeable circuit right on that, so you would be able to almost like you are plugging in your phone and it is recharged. So our gloves goes on to recharge, and if you come to our lab, you would see the number of series of gloves are just sitting over there with the USB cable which are being charged. And it definitely looks like weird for people coming from outside, but they do see gloves being charged actually, so it's happening. Difficult to say right now. I can only talk what the prototype cost. It's I'm not counting that as a labor cost right now. But if you look at the material and everything, I would say that the gloves right now are costing something around $40 per pair, I would say. But it is going to be different when it goes into manufacturing side of that. So yes, right now prototyping is costly, but manufacturing will reduce the cost tremendously. 5G would definitely help heavily because then we don't need to rely on only Wi-Fi network in at the patient side. If it can be directly through the data, that would be much more efficient for us. But then we can do processing on board, and then we only send the features. And that means also you can actually reduce the data. In India, you may not maybe worry about your data, but in US, we worry a lot about data because it is very costly here. And you probably have some really good carriers that they give you almost like in a good data rate there. Yes, ergonomics of the sensors would be very, very interesting areas that we need to work on. We are looking for partners in the ergonomic study side of that. okay, so with the one single charge, we are able to go for 4 hours of data collection, but each time we only collect data of 20 minutes. So that means we are thinking that this data collection would happen like 2 to 3 times a week, not like every day. So we are hoping that weekly once the patient will need to charge these devices. We don't know yet how to mass manufacture this. We are still in a prototyping phase of the smart textile. So we are still, looking into that. And we are working with some textile experts on this, so looking at the manufacturing process for this. Okay, I think a lot of good questions, and maybe let's hold some questions for the end of the talk. So let me take you to the another journey, which is a 3D printed prosthetic. It's not going to be textile right now, but it's going to be 3D printing technology and how that can be useful. So, so amputee, I don't know if you know this word amputee, a person who has had a limb amputated. That means sometimes either they have amputated limb right from the birth, or the limb was amputated because of some reasons, something like injuries, or sometimes diabetic people have limb amputees. And there are lower limb amputees, something like that. And again, there are, if you go into lower limb amputees, there are multiple different kind of classes out there in the lower limb amputees, and also upper limb amputees. And think about the life of these individuals, that how they can kind of do their daily life work. So these amputees are not small number in the world. So let me give you statistics. In US itself, it is estimated that we have 1.9 million amputees in the US right now. And it's due to various reasons. And of course, we have also high amputees rate in veteran population. And there is another interesting country in South America called Colombia. In Colombia, there are very high rate of amputation in the world. And, because of they have some, mine workers over there in Colombia. And because of that, and also because of construction works over there, and due to birth, defects, they have around 200 to 300 people per 100K inhabitants. So that's in a very high rate of amputees in that country. So if you are wondering about India, reportedly, India has about 500,000 amputees. And every year, 23.5K, amputees are reported. It's not a small number. And also there might be unreported cases in India as well. Now, what we did a few years ago, there was an interesting program between US and South American countries. And they call it 100 strong in Americas. What it means, 100,000 strongs in Americas. What it means is that they wanted to see 100,000 collaborations between two continents, essentially. And at that time, we collaborated with the Vocational Institute of Colombia, and it's called SENA. And the effort was that we came to know about the problem from their side, and they reached out to us and said that since you have interest and expertise in a wearable technology, would you be interested in helping us converting our cosmetic prosthetics? And I will come to that point, what cosmetic prosthetic means, to intelligent prosthetics. What it means that they are more technology driven prosthetics, but at the lower cost. It should not be expensive, because there is a low income country, and people who are actually amputees are in a low income class, and how to make it affordable. And here is the team, and it's a cross country team, by the way. and I had an opportunity to lead on the URI side, and I had a number of people on the other side on the Sena. So we had actually so talking about the problem, we had identified 4 people, and they actually identify in a Sena side, they identified 4 people. So let me talk a bit about these 4 people. 60-year-old candy seller who was riding a bike on a single hand was selected, as our case study in this 1-year-long project. Then we had a 21-year-old who was a worker, then we had a 14-year-old who likes playing guitar and he wanted to play guitar. And then 7-year-old, a boy who wanted a cyborg hand because he was watching a lot of cyborg movies. So you can see that, different age groups with the different kind of requirements they had. Now coming to the cosmetic arm. So cosmetic arm, what it means is that it's just visible over there. It has no function. It just, you can kind of put it on your amputated limb, and then it just does not do any function. It just shows that there is a cosmetic, limb you have. Then there are called the split hook functional arm, which are mechanical ones, and then you actually use, your shoulder muscles to actually click on and off your fingers there. And I have seen a number of people using that in US, and we actually bring them in the lab. But look at the cost. Cosmetic arm itself is a $5,000 US dollar. And a split hook function arm is a $10,000. It's a significant amount of money just to get a prosthetic. And then if you want to have a motorized arm with all the motors and mechatronics in that embedded into it, it would be costing from $20,000 to $100,000. It's a way more expensive than in a car, for certain people, and it's not affordable for low-income countries. Even in US, it's expensive, And so idea was that can we create an affordable and sustainable solution for robotized prosthetics. So I'll go pretty quickly that it was in a Colombia. People visited us in the beginning, and then we visited them. So idea was that they come here with those requirements generated from those 4 people. And then this is the photograph when they arrived at URI. And then they worked with us closely, and then we understand from their side that what was the ergonomics requirement in terms of what was the size of the hand. 3D printing models were created with them. And by the way, they know very well 3D printing. Even we learned 3D printing from them more than we could teach them. Actually, they learned from us about how to design technology that can be embedded within 3D printing. So it was a bi-directional learning, and they were very well motivated, to help those individuals, because they in their vocational institute every day they actually look at the amputees, and then they need to create technologies for them at the lower cost. And then there was a lot of brainstorming that how we're going to create this, and we created a 15 days long design-a-thon. What it means is that you start from a day 1, and at the end you have to have prototypes ready that you can take it home after 15 days, because they only arrived for little over 15 days. So also we have to consider in between they had to do a sightseeing and everything like that. And then our team went over there to Colombia, and it was a very interesting experience for some of the American students who went over there and looking at the different country, different language, and a different culture essentially. And over there, they actually make sure that the now technology is taken to the community, and then showing them to the community that how it works. And then essentially idea was that we give them these prototypes in the hand, and then they will start to improvise that prototype to fit onto those individuals. And then lastly, lot of cultural exchange happened, English and Spanish. And if you think that I learned Spanish, I don't think I can speak Spanish, but I learned a lot in terms of if I can what they were talking, I could understand a lot. But Colombia is a big fan of soccer, so we had soccer games and everything like that. So a lot of cultural exchange happened. Now, coming back to our participants, right? At the end, each person got their robotized prosthetic arm to get an investigation on this, and uh, it was, I would say, an emotional moment to see some of these people, how they reacted when they actually move the arm with their own muscular tone. So what it looks like that when you actually have, let me see if I can show you here. So we actually put in a EMG sensors right over here. And when you actually use your muscle over there, then it would actually engage the motors, and motors would be triggered over there. And once they started to move these motors and then hand was moving, it was for them, it was an emotional moment, and also for our team, because they actually took it home, and now we are actually conversing with them that how we can find more fund to actually run this project even further. And a lot of technology-wise, we felt very happy that we actually use some design thinking processes for designing this kind of prototypes and investigating. And a lot of failures we have faced in this. It wasn't a straightforward process, and but you can see that they even created a flyer for this particular program, that the individual was taking this flyer to the community to show that you should go to this Sena and try out this 3D printed prosthetic arms. So that was something, touchy story for us there. I had an also opportunity. So maybe I think, I would stop over here, and I would like to ask if you have questions regarding this one. And I would like, to definitely ask that the last question that is asked, that do you have any interest in a cross-country collaboration like this one? And we would love to explore, and I have been dying to actually find out this kind of collaboration in India. There is something like that, does not need to be always about prosthetics, but can be about something else, then we would be happy to work and figure out a project. How much our prosthetic cost? It was, I would say that it was in a range of something like a $200 per piece, I would say. And again, these are not manufactured one; these are 3D printed one with the technologies embedded into it. We haven't costed a labor yet, because that's a different kind of statistic that we have to go through. But in general, the cost of the supplies and design and everything would be somewhere around $200, round about that. And that was still kind of little expensive for them, and we are. But yet, it is still way cheaper than other one. Will it actually solve all the problems for them? Probably not, but it can solve some of the problems for them. For example, they can wear this glove and can do some basic things, like, for example, the person that candy seller can ride a bike with the two hand, for example. They can use mechanical arm, but again, mechanical arm is very expensive. So there is another thing. Plus, they can actually hold things. They can hold a cup. They can drink water. All these kind of things can be possible with this arm. They can. There are, on the research side, we can go on and on. We can find out a lot of problem we can solve. But again, it will be adding a cost over there. We can add sensors to the fingers and everything. We have a student who is passionate about this and working on this on his PhD on this particular project. So it's definitely an interesting area. But at the end, the reason we like this project, because it is helping people at the end, and our technology could go and help them out. I had an opportunity to be a part of a larger teams, to create another different kind of initiatives in our university. Something, there is one called the AI lab that we created together with a number of people. I also got a chance working with other members of URI, and we created an innovative URI launch lab that is designed to help students create their own startups and ideas and innovative ideas, and translating those innovative ideas into a product that is happening since last 2 years. And And recently, very recently, we actually had created in a very quick, almost close to non-profit. We called it the Rhode Island Rapid Solvers, and it was a 80 members, team that we created pretty quickly. And this was the time during end of March to April and May. During that time when the pandemic was at its own peak. And doesn't mean it is different right now, but I think at that time the state and healthcare workers and the organizations, they do not have a stockpiling of those PPEs, and nobody even knew that what is called face shields at that time, and then we actually worked out a plan that how we can bring the face shields to the healthcare workers, um, and ambulances and emergency response teams, and police, nursing homes, old age homes. So we kind of we had a whole different kind of like this. We had a manufacturing system, assembly system, and distribution system, and this was without cost. We didn't ask for a single dollar from anybody whom we delivered. But we did ask for donations at the time, so everything was donation based, development. What we have been learning so far, and this would be helpful. We always like to share with people what we have learned so far and what we are still learning today. If you have an idea, today, just don't hang with that idea. Start working on it right from that moment. Doesn't mean that you need to work right on the hands-on, but it even an idea itself start to form, and it requires shaping. It requires a lot of thinking and brainstorming. So you need to kind of start sketching the idea as soon as possible, because most of the idea or all the ideas would have a design, and you should start thinking about the design of that and brainstorm that. And this is what we have started to do. We didn't do in the past, but we have learned over time that how you should, once you have an idea, and again, it's not my idea, by the way, it could be anybody's idea in the lab that they can, and we bring it to the table and everybody should kind of brainstorm together. Know the problem well, don't get on a half-hearted with your problem, knowledge about the problem. You need to have a deeper understanding of the problem. And if you don't, then you won't be able to create a correct solution for that problem. So that's why knowing a problem is very important, and that's why you should be reaching out to the people who have the problem. Sorry, I have a typo there. They will tell you what exactly the problem are they facing. Write down all the problems they have, and then before you come up with the solution. And many times, and that if you know the problem well, you have solved the solution or solve it 50%. That is kind of in a saying, and I'm just paraphrasing that. So I think knowing the problem, you do need to go into details over there, and you need to ask right questions to the people and know the real problem. And lastly, form a team. Form a team. Like-minded people who are motivated, they like to, and again, it can be diversified team. It can be, for example, in our case, we have textile designers. We had now in this case 3D printing experts who knows the problem. You don't need to know 100% of everything. You need to find people who also have a complementary expertise, right? So those things are important. And like I'm just mentioning over here, sometimes you need people on your team too. Many times it is not that because they have a skill, because you want people on your team also possible. And afterwards, the skills can be developed in the team. It is not always that people come with the skill. And we are in academia, and we know very well that the student will come with the motivation, and then they will be developing their skills. So it's almost like, like you are forming a team for a gully cricket, right? You already know that somebody does not know how to catch, somebody does not know how to field, somebody does not know how to bat, but still you bring them because you know that you want a team. Otherwise, you can't play a cricket between one person and two people. So like that, many times it is a team sport, and you need to bring people on board and then motivate them to create a skills by themselves, or you create training platforms for them. For that, what I do normally for training platform, I actually have a course that I have been teaching. I had to take a break recently because of some leadership change, and I had to take that academic leadership position at URI. So I'm teaching their other course right now. But this is very close to my heart. The wearable IoT course. It had a business component, and also it had a technical component. We used to bring in a guest lecturers, something like what I'm doing here. Same like this, I would actually invite other people and come to the class and they share their knowledge. And we also had a successful startup that is actually a start idea came in our course, and then it became a startup at MIT. Afterwards, we also come with the technology for even PAT. We had students who go out and win elevator pitch competitions, and we trained students actually during this class. We don't assume that they have those skills, so we actually train them to go and do this kind of competitive. They go and compete in the competitive, events. Student-driven activities. Our lab is highly student-driven, and we make sure that the students are trained and students are provided platform. They are provided platform to learn the problem and also train themselves. We go to schools. Because of COVID, we are not able to go right now, but we normally go to school 3 to 4 times a year inside the classroom. We don't just go and give a lecture. We do a hands-on activity over there. We also go to the lots of events where the school students are coming over there, and then we demonstrate our technology there, and we try to kind of motivate. I won't say that we want to make everybody engineers over here, but we want to just motivate that if they have interest, then they can actually work in that area. And we do a lot. I have created an event at URI. We call it an health hacks, which is a hackathon for health problems. And it has been going for almost 5 years now. It is a 6th year. We even did actually in a virtual hackathon this year. And again, this is student-centric. So students would come up with the ideas and they would be developing that. And I'm sure hackathon is not a new concept anymore. And we have kind of very big brands that they come to us for sponsoring this event, including J&J, IBM. And lastly, this is my final slide. And I'm just I would say I'm just a mouthpiece who is just speaking on behalf of the entire team. I happen to be invited, but I'm speaking on behalf of the entire team. And without team, I don't think what I'm speaking everything over here is possible. And our team is highly diverse. This is a photograph from 2018 in summer, and we had people coming from background in 10 different countries. And also I have a diversity in my collaboration with the different kind of doctors coming from a different kind of background. And we go to NSF, NIH, and many other organizations for getting a competitive funding. And it's getting difficult, more and more difficult to get a competitive funding in a current competitive world. But we are surviving, I would say. With that, I would say thank you all for listening to me patiently, and I'm open for questions.
Hi, Kunal.
Arupda, how is life?
Hi, Kunal.
So for this, who are expert, you will ask questions. I am not. Definitely one component. You are up. So maybe after this question session, maybe we can talk about that. Okay.
Sure. Yeah, you are cutting off a little bit, Arup. So
You could.
okay, Abhay, you are muted.
Well, Kunal, thank you so much for the wonderful presentation. I have a question.
Yeah.
Am I audible?
Yes, you are audible.
Yeah, my question is like in the first session, like you described about smart textile, and there you used flex sensor, and you've seen like how for the prosthetic patients. So do you have any plans to change that sensor to take place, like so that for further research or to make it more comfortable for the for long-term purpose?
Yes, yes, Abdullah. Very interesting question. So we are going right now from off-the-shelf flex sensor to the textile-based sensor made of the conductive textiles, conductive threads, and velostate material. So we are kind of currently working on that. The validation process is really difficult, of those things. So we are looking at the standard processes that how we can validate these sensors. We know how to make it now, but now how to standard what are the standards we can use to validate these sensors, and that's what I think our current challenge we have, and we are trying to figure that out how we will create such kind of platforms. So that's very important question, Abdullah.
Oh, thank you so much.
Yeah, Professor Kunal, can you please explain what you were doing with the miners? Because you were experimenting your prosthetic with mine workers. Okay, because a lot many mine workers were amputees. So what exactly you were testing with? Because Dr. Jayantu is there. He is a mining expert. So
Yeah.
it was of great interest for him.
Yeah, I think Abhay, it's thank you for the question, and we particularly only the community was coming from a mine workers actually over there in Colombia. So we if there is an interest towards like how the prosthetics can be created for mine workers for a specific functions of their life, that would be interesting research question. But in our case, we were just looking at the daily life functions and how to improve that.
Sir, I have a question. So what was your first funding or any donation? Like how you motivated to work further on your ideas and prototyping work?
Yeah, I think first large funding, I did receive a lot of small funds in between, but first large funding was a National Science Foundation's a grant, which was this one. What I mentioned was my third grant, but before that, I received like 2 large grants from NSF on wearable technologies. So those were, I would say, somewhere around each grant was around $200,000 in USD. So that's my starting point, I would say. But before getting those grants, I had many small grants. That's where I think I learned little grantmanship, and then now we are trying to work on a very large center level grants, I would say, and more onto smart textile areas, and how they can be useful for health problems. Yeah, and I really like the quote of Albert Einstein over there, and I agree with Albert Einstein on that you would spend 55 minutes thinking about the problem and 5 minutes thinking about a solution. Exactly. And I think that is something what we need to do more.
So, is my voice audible, sir?
Yes.
Sir, first of all, thanks a lot for this amazing session, sir. Sir, I'm Saurav, pursuing electronics, like engineering in electronics and telecommunication in Bangalore. I'm actually very much interested in IoT, and I've pursued like several courses in NPTEL and from the Indian Institute of Science. Sir, and I was really interested in innovating a system for like mainly for remote patient monitoring his vitals and etc. over the internet. I'm also a system administrator alongside like dealing with cloud data and application etc. And is there any ways like where I can get my innovations into place and work together with like-minded people, like gather a team with me and start working on an idea, or join a team who's already working on the same ideas and somehow get myself into research. I also wanted to ask this question to the other people in this platform who are present today.
Sort of very, I think it is a higher level question, I would say, and maybe many people would have similar question that where to start when you have now skills developed, but then what is the ecosystem looks like. And, there are different venues in this process. Uh, it depends on whether you want to be a part of something that is already out there, and can be some organizations that you can start working with, or you actually can incubate your own team, and can we start with just 2 or 3 people and find out a problem that, and again, sort of try to find that very pointed problem to solve rather than a very generic problem to solve. So that means, if there is a problem in a remote setting, remote patient monitoring, and let's say that you find out something that when a disorder, let's say cardiovascular disorder or a diabetes or something like that, which is normally high prevalence in India, then you should be meeting with something like a doctors who are interested in this kind of remote monitoring side of that, and talk with them, and maybe you can talk with the patients who are also in a similar facing similar problems, and interview them what problems they are facing, and trying to find out maybe there is some kind of funding available in that area through even the smallest funding that get you started, essentially. And there is one thing at a global level, more on the exchange side of that, then definitely you can send out an email to me, and I would be happy to kind of go at a global level and how exchange of this kind of projects can happen. So definitely that is also possibility.
So I actually thought of an idea of an application where the patient's health status can be remotely monitored. For the well wishers of the patient, they can monitor his vitals and etc., his heartbeat and whatever it is, through the internet over the app. And that was my thought, sir. I had actually started working on it and had penned down my ideas and all of that. But I was only lacking the motivation to build it further, sir. That was the thing.
Maybe we could have a separate call at some point, and we can kind of discuss more details, and can go over your slides and what you have in mind and everything like that. So that could definitely hopefully boost your motivation in one side, and maybe I could offer some suggestions on what could be the next venues for that.
Yes, surely, sir. That would really be grateful for me.
Sure. My pleasure, Saurabh.
Yes, sir. I'll shoot an email today, sir. Probably this week. I'll just shoot an email. Thanks a lot, sir.
My bad. You're welcome.
Hey, Saurabh, this is Sahil. Actually, we to saline monitoring system, and it was pretty much we worked on that, and that was basically we were monitoring by using some IoT like applications and using the cloud computation. So we can also help you, like our team can help, like collaborate with you and for this type of medical science, and we can work together. We can collaborate with you.
Yes, sure. Can I get your email ID so that I can contact you further?
Sure. I will do a message to you. Fine.
Yeah. Okay.
Okay, great. Wonderful. I'm glad that there is a connection made over here. Yeah, I think, if there are more questions, I would be happy to stay a little longer. But if no, then, I would like to thank everyone. And I know it is late over there. You can go off for your dinner.
Yeah, I think, do you have any questions, students? All right, all right. I'm taking it as a no. So, thank you so much, Kunal. Such a wonderful and very fruitful session. And normally our students are very shy to ask questions, but this time they blasted with many questions. So we are very happy for that. And yeah, yeah. So that's one reason actually you take it in a very simple and very interesting way. That's why students are very much engaged in this session, and that is really wonderful. And we will looking forward to meeting you again because we have our next cohort project starting soon. We are accepting projects from different background, different domain. So hopefully you can be a mentor in your free time. We will happy to invite you on our Cisco thingQbator program in the next cohort. So hopefully that will work. Abhisa, what your suggestion?
Fantastic.
Sure.
Idea, Akhil, your idea is fantastic, and definitely I hope Kunal will cooperate us. Definitely. We expect Kunal. It was a fantastic talk. It was awesome talk.
Thank you, Abhay. My pleasure, and I'm glad that students liked it, and they had some curious questions, and I'm always it's helpful for us, getting feedback from the students.
After all these serious questions, may I have a very simple, beautiful, and sweet query?
Yes,
Kumar.
sure.
Actually, you have given a wonderful talk. We appreciate your inspiration, seeing your team and helping in startups and all. Already, I have written in the feedback also. We are working with Professor Samal Saab and few ministry minds and some other patents and all, especially IoT, WSN, LoRa and other applications, especially for mining industries.
Yeah.
Because mining industry is such an area where people will be afraid of even going or entering into and do any experiments. Right. So that's why I used to tell as a scientist for 2 decades in CSIR and ministry minds, covering over more than 100 projects with so many innovative trials, of course, on methods and other things, with little more instrumentation also. Basically, I would like to know whatever you developed, that hand, whatever that sensor and textile you made, what is its approximate cost? Just some idea.
You mean the prosthetic one?
System. Suppose if that system, now you must have already patented or given the rights for any manufacturing, or is it available? Suppose if we want to use such type of a system, especially we need in the mining industries, as our Professor Samal Saab rightly said, because he visited along with me so many mines in a very typical situations. As a computer science engineer, he understands many things of mining also now. So suppose if we want to use that as a set and try to implement that in the mines to study with your developed system, is it possible?
I think Dr. Jayantu, this is a simple question, as you said. It's a simple way to say that your institute and my institute can just sign an MOU and we start from there. It's as simple as it is, and I don't think being in academia we have any problem in going out and using our system over there for the mining workers and how that can be used over there. So I don't think we would have any issues.
So anyway, Professor Samal Saab is there with us as a team. We will be discussing in more details later. Your email is also provided. We will be in contact. So thank you very much.
Just few days
I'm happy to bring in more professors.
Miners occupational health problem. So how to find solutions for various medical problem, various health problem of miners. So we'll
I see. No. Yeah. That's the thing. I think coming to the low income community, definitely we would have a strong interest in that area to help out.
Low income community.
Yeah, exactly. Yeah, I think it would be essentially when you are discussing within yourself, always good to see that whether there are opportunities out there between US and India, and whether we can create a kind of a project which I know that there are some funding opportunities out there between US and India, and other thing also exchange student programs is no problem at all for us. That way also we can have a beginning of the research, because that becomes a little easier. So I would be happy to discuss.
We could try this one IUSTF once we initiated the program. Didn't capitalize that one, so we could try that for exchange as well. And hackathon, if you can just help us for building a bio hackathon or something like health hackathon that you are doing there. So that initiative has not done here so far. Dr. Samuel
Okay.
might in this aspect. Okay, thank you, Kunal, for this nice
Thank you.
presentation.
Thank you for that.
Thank you, Kunal.
Hello, sir. Excuse me, sir. Yeah, hello, Kunal, sir. So I also I had a question. As your all the experiments focus on the physical, not on the biological symptoms of the patient. Okay, not on the recording the impulse or the input inside body, inside body technology, inside body features. So what was the not adapting the feature of AR? You have also known doing the research time. You would also have known the word of AR means. Why don't you use the word AR technology AR and pose detection system? Is because you can do these things with the pose estimation of your body, like the ankle and the fingers, all things you can do with the estimation. So what was the reason to reject that one and go with the sensors?
Yes. Very interesting question. I have been asked this question so many times, and it's a very valid question actually. That so one thing is that these are the individuals at home with the limited cognitive processing ability sometimes, and now the thing is that more infrastructure need to bring into home. And if they need to sit in front of a camera for a certain, with a certain background, and there could be a lot of privacy-related issues in this thing too. The biggest concern definitely is the privacy in US. They do not like to be monitored through a camera system. Now, of course, you can have a 3D depth camera and everything, but it also requires its own research to make sure that it can work in an unsupervised environment. And I think it is possible. I can actually write another proposal and kind of investigate which one is a better. But again, it is at the end is a matter of it's a matter of kind of a research effort that we need to put it behind. We do have, by the way, the 3D depth camera in our lab, and we are actually validating the same sensors against those depth cameras. So it is not that we are not doing it. We will see. I think it's an interesting venue to check in the future that whether this technology can go at home and also do the data collection. And difficult to answer right now with 100% accuracy, but it requires its own research. I agree. And I have a question here. Does your company have any patent ownership? So we don't own patent. It's a University of Rhode Island owns the patent. We are only inventors. So we have disclosed the number of IPs with the University of Rhode Island, and they make decision on going for patent or not. So they are working on it right now on the patent application. Okay, with that, I think it was a wonderful chatting with everyone, and I really appreciate everybody's time. We'll be in touch.
Yeah, thank you, Kunal. Thanks, everyone. Thanks for spending your time with us, and thanks a lot, everyone. Yeah.
Thank you. Have a good night. Bye.
Okay, Jai Hind. Very good evening once again. Namaste.